Fatty liver, ultrasound. Areas examined and treated. Liver, right upper abdomen, gallbladder area, if included, bile ducts, if included. The procedure. Diagnostic. This is a non-invasive imaging test of the liver. It uses sound waves to create liver images. It does not use radiation. It may help detect fatty changes in the liver. It may help check liver size, texture, cysts, masses, or bile duct changes. Therapeutic. No treatment is performed during the ultrasound. Treatment recommendations are made after results are reviewed. Before your procedure. Schedule your procedure. Appointment. Schedule your fatty liver ultrasound appointment with GastroDoxs by phone at 832-632-4070 or in the office. Location. An imaging location will be suggested based on your insurance and geographic area. Please refer to the locations page on our website. Insurance. Our team will obtain the required insurance prior authorization if needed. Financial. GastroDoxs provider fees will be collected if applicable. Imaging center or radiology fees may be separate. Orders. Our team will send your ultrasound orders to the imaging center, hospital. Transportation. Sedation is not usually used for this. You may usually drive yourself home after the test. Follow transportation instructions if another sedated test is scheduled the same day. Changes. To cancel or reschedule, call or text. GastroDoxs at 832-632-4070. Register with the imaging center. General. A representative from the imaging center, hospital, or radiology facility may call you to discuss the registration process, time, and location of your ultrasound. Clinical. The imaging team will discuss the following: liver disease history, medical history, medication list, previous liver imaging, recent lab results. Financial. Imaging center, hospital, and radiology interpretation fees are independent from GastroDoxs. The other fees not related to GastroDoxs are to be discussed directly with the imaging center or radiology facility. If you have not heard from the financial representative 24 hours before your ultrasound, call them at that time. Clearance. Clearance. Special situations. Clearance is not usually needed for fatty liver ultrasound. No anesthesia, needle, or incision is usually involved. Tell the team if you are pregnant, have severe pain, or cannot lie flat. Extra instructions may be needed if another test is scheduled the same day. Medications. 2 weeks before. No medication changes are usually needed for this ultrasound. Continue medications unless instructed otherwise. Follow facility instructions if another sedated test is scheduled. One week before. No blood thinner hold is usually needed. Continue diabetes medication unless fasting instructions change your plan. Continue other medications unless instructed. 1 day before. Continue medications unless instructed otherwise. If fasting is required, ask about diabetes medication or insulin. Ultrasound day. Take medications as instructed by the imaging facility. Some facilities allow medicine with a small amount of water. Do not stop medications unless instructed. Other. The imaging facility may give different instructions based on appointment time. Follow facility instructions if they differ. Call GastroDoxs with questions. Diet instructions. 2 weeks before. Foods. No change unless instructed by your provider. Liquids. Drink water as usual unless instructed otherwise. 1 week before. Foods. No special diet change is usually needed. Continue any liver diet, low sugar diet, weight management diet, or low fat diet, tantas, recommended by your provider. Liquids. Drink water as usual unless instructed otherwise. 1 day before. Foods. Follow facility instructions. A low-fat dinner may be recommended if gallbladder imaging is included. Avoid heavy, greasy meals if instructed. Do not drink alcohol. Liquids. Follow facility instructions. Some facilities allow water before the test. No alcohol. Ask if water is allowed during fasting. Ultrasound day. Fasting may be required before liver or abdominal ultrasound. Many facilities ask patients not to eat or drink for 6-12 hours before the test. Ask how to take morning medications if fasting is required. Ultrasound preparation instructions. Preparation instructions. Bring insurance card and photo. ID. Wear comfortable clothing. Avoid heavy or greasy meals if instructed. Fast if the facility tells you to fast. Ask if water is allowed before your test. Bring prior imaging reports if available. No bowel preparation is usually needed. No sedation is usually used. Call GastroDoxs with questions. Procedure day. Diet. Follow the imaging facility food and liquid instructions. Arrival. Please arrive at the time given by the imaging facility. You will check in at registration when you arrive. Pre-test. The imaging team may confirm your name, date of birth, and order. Your medical history may be reviewed. You may be asked when you last ate or drank. Sedation. Sedation is not usually used for fatty liver ultrasound. No intravenous sedation medication is usually needed during the test. Position. You will usually lie on your back and may be asked to turn slightly to one side. Imaging. Warm ultrasound gel will be placed on the skin over the abdomen. The technologist will move a handheld probe over the right upper abdomen. You may be asked to take a deep breath or hold your breath for a few seconds. Post-test. The gel will be wiped off your skin. You can usually return to normal activity right away. You can usually eat and drink after the test unless another test is scheduled. Diagnostic. Images may show liver size, liver texture, and fatty changes. Images may also help check for liver masses, cysts, bile duct changes, or fluid. Therapeutic. No treatment is performed during the ultrasound. No biopsy is usually taken during this test. Radiologist. A radiologist will review the ultrasound images. The radiologist will prepare a report. The report will be sent to your provider. Follow-up. Our providers will review the report in detail. The findings will be reviewed with you in detail upon follow-up. After your procedure. Recovery. No recovery time is usually needed. You may return to normal activities after the ultrasound. There is usually no pain after the test. Transportation. You may usually drive yourself home. No driver is usually required. Transportation restrictions apply only if another sedated procedure is scheduled the same day. Symptoms. Normal post-test symptoms. Mild temporary pressure feeling from the ultrasound. Probes slight skin. Stickiness from gel residue. No major symptoms are expected. Abnormal post-test symptoms. Severe abdominal pain. Fever greater than 100, vomiting. Yellowing of the skin or eyes. Any other severe or unusual symptoms, please call 911 and go to the nearest emergency room. Appointment. Ensure that you have a follow-up 2 to 3 weeks after the ultrasound. Results. Your results will be discussed in detail. Treatment recommendations will be given. Questions. Call or text GastroDoxs at 832-632-4070. Thanks for watching.